If you've been suffering from chronic pain, if you've tried everything, you've been to physical therapy, you've been to multiple doctors, you've tried cortisone injections, PRP injections, you've really tried everything, and you just can't get out of pain, you might want to look at a different type of diagnosis. For example, I was diagnosed with TMS about 15 years ago. Let me tell you my story and how this story might really help you get out of chronic pain. Okay, now if you follow me a little bit on YouTube, you know that I've owned a gym. I'm a very physical guy. Most of my life, I've done like extreme type sports. I rode motocross as a kid. I've skateboarded. I've surfed all over the world. You know, I've always working out and been very active. I snowboarded everywhere. I've hurt myself so many different times. But when I was younger, all my injuries would always get better. Like, for example, I was surfing, I hit the ground, you know, pretty hard. I herniated a few discs on my neck, right? But I got better. Same thing with my back. I was windsurfing, herniated a few discs in my back. I got better. I fell snowboarding. I tore the labrum in my shoulder. I got better. Right? First, I tore my MCL in my knee. Then I tore my meniscus, had a knee operation. And that was somewhat of the turning point for me. And let me explain to you what happened. I had a knee operation with a really bad result. Like 2 weeks after the operation, I had like pain in my knee. It wouldn't get better. Had a second MRI 6 months later. It showed that, you know, some doctors felt that I had scar tissue. Some people wanted to reoperate on my knee, but they always told me, Mike, you know, if you can live with the pain, live with it. We can reoperate on your knee. It may not get better. And over the years, I've had multiple opinions, but it was so upsetting to me because it was such a life-changing event that this happened to me. And this is about 15 years ago. I was around 44 years old. So all of a sudden, besides my knee pain, I started getting pretty bad neck and lower back pain out of nowhere. It just kind of creeped up and it wouldn't go away. So I was in a really bad state about 15 years ago. I had my knee was still pretty bad. I had neck pain and I had back pain. And whenever I went traditional type doctors like surgeons, they would say, Mike, look, you got herniated disc. We can go in there, we can fuse, you know, we can fuse your cervical. One doctor wanted to even put a rubber disc in my neck. Same thing with my back. He said, Mike, you know, you got a lot of herniated disc back there. Almost every disc is herniated or bulged in your lumbar spine. You're going to be in pain, you know. Do the best you can with it. We can operate. Hopefully it'll work, but, you know, do the best you can. So I was somewhat at a desperate state about 15 years ago. So I decided to go see a doctor named Dr. John Sarno. A friend of mine actually had horrible back pain to the point where one time he had an episode where he fell to the ground in excruciating pain, had to call his wife up on the phone to get the EMS people to come to the front door. And he couldn't even get off the ground to get to the front door. His wife had to come home from work, had to open up the door, take him to the hospital in an ambulance. And he saw this doctor named John Sarno, and that cured his back pain. So let me explain to you what TMS is. First of all, it stands for Tension Myoneural Syndrome. And Dr. John Sarno changed the name a couple of times, you know, over the years. And what it is, and it's kind of hard to accept, but he diagnosed me with TMS. Like, he looked at my neck MRI, he looked at my back MRI, and that's the main reason why I went to see him, not necessarily for my knee, for my neck and my back. And he said, Mike, you got TMS. He said, there's nothing in these MRIs that would tell me that you should be in chronic pain. This is what's going on with you, and this is what the diagnosis is. The pain that you're feeling in your neck and your back is actually due to mild oxygen deprivation. That means your body, your central nervous system, your brain is saying to you that it's going to reduce the amount of blood and oxygen to these areas in your body and create pain for the reason of to distract you from what's internally bothering you. Meaning that this pain is almost a favor that your brain is producing this pain, that your central nervous system is producing this pain to distract you from underlying unconscious emotions that you're either fearful of, or you're like petrified of, or like underlying anxiety, and you're unaware of these feelings. Because if you felt these feelings, your brain wouldn't have to produce a pain signal. It's almost a favor, it's a way of survival. And then he broke it down into much more detail. He said there's certain personality types that fit into this category, like very conscientious people, hard workers, people who want to be good and perfect, people who want to be liked. And I kind of fit that profile just well. When you read his book, like Healing Back Pain, he has multiple books. I read all of his books. And if you see yourself on the pages of this book, like I said, you know, that sounds like me, you might have TMS. And the thing is, how do you cure TMS? How do you cure this chronic pain? Is by just telling yourself that the reason why you're feeling this pain is to distract you from really bothering you. For a lot of people, that's enough. Like, for example, a lot of famous people went to see John Sarno, like Howard Stern said he cured himself from back pain. Mike Stossler, you know, 60 Minutes, he cured himself from back pain through Dr. John Sarno. Larry David, you know, Seinfeld, the Larry David Show, he cured himself from back pain through John Sarno. Sometimes that knowledge alone is all it takes. Just understanding that the only reason why you're feeling this pain is to distract you from what's really bothering you. See, other people have a little bit of a harder time. I personally had a harder time. Initially, I did have some very good pain relief. But over the years, when things get rough, when I'm stressed out, I feel like my back and my neck starts bothering me. What prompted me to make this video is because my neck is somewhat out of nowhere. I may have pushed a little too hard in the gym. I kind of tweaked it doing something silly, like trying to fix one of my stereo components broke in my house, and my neck has been really bothering me. So besides doing my normal rehab type stuff, I'm also like getting back in the mindset that I have TMS, and then I started doing things like journaling. Like I'm trying to realize all the things that may be subconsciously upsetting me. See, when John Sarno saw me, he said, Mike, it's like you have like a reservoir. You have to go back to like your childhood, write down all the things that maybe troubled you as a child, right? Then you have to go and talk about all the things that are stressing you out right now. Like what's going on in your life? What could have triggered this TMS? And then just getting older, you know, my thing, I think what happened to me 15 years ago is that I was so upset that I had a bad result with this knee operation. I went from squatting 405 pounds to like not be able to do body weight squats. You know, I'm a fitness guy, I own a gym, I'm a fitness trainer, I'm training people. It dramatically affected my career, you know, and then by getting multiple different opinions with my knee, everyone's telling me something different. I never had two doctors tell me the same thing on how to fix my knee. They all want to re-operate on it, but they all want to do a different operation. It just created a lot of internal conflict, I think, within me. And that's why I had this first episode of neck and back pain 15 years ago. And I have to say, my neck and back did get better. And my neck and back is pretty manageable. But what reminded me of this TMS diagnosis is this recent episode of neck pain I have. And I have to say, my neck is feeling better. So I've been journaling, writing down a lot of my feelings. I'm trying to figure out internally, subconsciously, what the root causes and what would try to distract me from realizing these things. And it's funny, when I saw John Stone, he said, Mike, you know, you're a fitness guy, you're a gym, you're gonna have a hard time with this diagnosis. I know it. So years ago, Dr. Sarno would send people to physical therapy as a combination, just as a safety. But he realized years later that you can't really do anything physically to try to solve the problem. It's a mental issue. Not that there's anything mentally wrong with you. It's not. It's almost a compliment to say you have TMS. You know, people, super successful, like incredibly motivated, good people have and get TMS, but you have to take a psychological approach to get you out of pain. And I've had success with getting rid of my pain just thinking like this, but it's still a struggle for me. I find like I wake up one day and for no reason, my back is just killing me. And I have to say to myself, what's going on in my life right now? Why did this TMS, why did this back pain kick in? So if you're suffering from chronic pain, I know how you feel. And if you tried everything, like I said, if you tried physical therapy, if you tried cortisone injections, if you tried like PRP, that's somewhat of a more advanced technique, platelet-rich plasma injections, if you spoke to doctors, especially if you go to doctors and then look at your MRI and say, you know, yeah, you got some herniated this there, but they don't look that bad to me, but you're in chronic pain, maybe you have to take more of a psychological approach to healing yourself. Now, you could go through psychotherapy, but you have to work with someone who understands the TMS diagnosis. There are doctors out there. There are doctors that specialize in TMS, so look for it. I know how you feel if you're suffering from chronic pain. I've been through it. Okay, so I hope you enjoyed this video. I got some other videos on Johnstone. I'll link a couple of them up that I did, but I'm going to start talking about this diagnosis more and more and really trying to spread the word.